Hello, I am Dr. Girish SP, consultant at Department of GI and General Surgery at Aster RV Hospital, Bangalore. Today, I thought I'll discuss recently a challenging case which we faced in our department, and really it required a multidisciplinary approach. A gentleman of 46 years walked into my OPD with a hanging huge lump swelling in his right thigh. He is already morbidly obese. His weight was 240 kgs. So, and over that, gradually he had developed a huge lump of a size of nearly 30 centimeter in his medial aspect of his right leg. But the challenge is he is so obese that we could not do any of the investigations such as CT scan or MRI. Then with difficulty and after discussion with our radiologist, we could make a part imaging of his thigh alone. So with that, we could conclude that it is a case of overgrowth of a fibromatous fatty tissue. So which was causing him pain as well as difficulty in walking. And in such cases, the most common or the obvious treatment is surgical. So now the next question is how to bring him to operation theatre, because obesity is the major compounding factor for him. He had a difficult breathing problem also. He was on a breathing machine, so that is more challenging. So with cardiologist and then pulmonologist opinion, so we could bring him to the operation theatre. Then we had a long discussion with the patient, with the family and anesthesiologist, because giving anesthesia is also very challenging, positioning the patient, and most of the Indian hospitals, we have a table weight can tolerate up to only 200 kgs. Here we had a gentleman of 240 kgs, so we had to make really arrangement starting from admission. Even the ward bed cot is also challenging because he would occupy the whole cot. So before admission, we had a multidisciplinary meeting with including the management who will take care of the ward admission, arranging the bed, in case required ICU. So all these things we had to arrange. So initially management supported as well. So we did a trial run of his admission, and then in the ward arrange him a special room and a special cot so that we move him around. He himself rolls around in the bed, everything. So once we are satisfied and he was satisfied, then we fixed a date for him. And next challenge was anesthesia. So anesthetist, they said it's a very high risk for a general anesthesia. So this was definitely challenging, and which patient may go on for a prolonged ventilator. So it was a challenge and patient was not ready to accept. So with our expertise of anesthetist team, they said we will try to somehow manage with a regional anesthesia, that is called injection into the spinal cord in the back. But his weight and the back fat layer was so much that we had to use a really special equipment for that. And then simultaneously we have arranged the operation table also after a trial and run. So with all these things, we could admit the patient, and then we took him for surgery. In surgery, they gave with a very special long needle, they could give satisfactorily a spinal anesthesia. And the next step was difficulty, because the location of the tumor was inferior medial aspect of the thigh, which was a dimension of nearly 30 centimeter, weighing around 30 kgs. The tumor itself was a 30 kg weight. So this to go all around and to operate it satisfactorily was a challenge. Again, we had to break the table, operation table into upper body half and lower half. And then we had to use special stands to hold the leg and to go around. It took nearly 4 to 5 hours to do satisfactory operation, though in any other patient with a swelling like this would have been a simple straightforward surgery, cutting through it and then just controlling the bleeding and just closing the skin. But here, because of the position and location, it was really challenging. So we could satisfactorily finish the surgery with minimum blood loss, with 4 to 5 hours of time duration. So after that, we were very happy with the outcome, and because patient was only in a spinal anesthesia, he recovered very fast. And then we kept him in the ward for 2-3 days, and then we discharged him well. After during the follow-up, he was the wound had healed well, and he was very happy, and he was very thankful to the services provided in our hospital. So here one thing I'd like to say is that it was really a team management, including the management, where we hardly involve the management, the hospital administration for this. Here, with a thoughtful thinking of the management, we could do all the trial run beforehand. So with this, I would like to say that at our hospital in Aster RV, we perform or undertake such high-risk procedures where we are equipped with multidisciplinary team management and good cooperation help in bringing out a better outcome for the patient.